should you charge patients for the touch-ups as a med spa? I understand that the touch-ups can be quite pricey because the price of the Botox is over 600 per vial, so it's really about $6 per unit. Even if the patient comes and they need, I don't know, 5 units, that's $35, and this does add up as a cost. But is it a right strategy for your med spa? In many cases, it is not. Many times when the patient comes back, it's because they are not quite happy. And if they're already not happy and then they have to do something to fix it that they're going to be charged for, then it will make them even more unhappy. And that can just spill over that unhappy threshold to where they go on Google and make that the one-star review on your page, which is going to cost you so much more than that $35 that you're going to lose in the cost of the touch-up. So in generally, most med spas have a rule of a certain amount of units that the patient can get complimentary, and beyond that, then it's something that they need to pay. Many times, expectation of touch-up need come from patient education. If you're an injector, then you know to explain to your patients that it's very common that after the treatment your brows may have a little bit of different lift. Like you look at my brows right now, and one lifts differently than the other. That's pretty normal because our muscles are not equal on both sides, and our bony structure is not equal on both sides. So it's very commonly that after neurotoxin you may have a little bit of difference that will be covered with a light one-point injection in a little spot, and it takes care of things. Typically, this is not really a mistake, it's just an enhancement to your original treatment. And that's how you as an injector or your injector should market it. This is an enhancement treatment. An enhancement treatment typically is not something that you would want to charge the patient for. The difference in story, if you have a patient who you know they may need to have a higher dose to begin with, and for some reason either patient does not want to do higher dose themselves, or you want to be more conservative because some issues with the brow ptosis or eyelid ptosis, and you want to be on more conservative side just to avoid complications. In this case, you as an injector or your injector needs to explain to patients that they may need to have higher dose, and in this case that is not going to be complementary. It's just that we are doing it in 2 steps to avoid potential complications.